Well, I want to welcome you all to Caroline Family Practice, and we are so honored to have the First Lady here with us today for our ribbon cutting. I think I'll turn it over to Rod to go ahead and make introductions.
Okay, I'm Rod Manifold, and I'm Executive Director of Central Virginia Health Services, and we have several providers here who are either past National Health Service Corps alums or currently National Health Service Corps people. And we also have one very special person who's a patient, Roberta Rollins, who has just a very compelling story to tell about her health center experience. Ryan Van Ramshorst, who's a medical student, fourth year medical student, and also a core scholar. So he's coming along. I haven't tried to recruit him yet, but we're working on it.
Yeah, he looks too awake to be a medical student.
And then Dr. Janice Sarter, who is a dentist at the Daily Planet, which is the Healthcare for the Homeless program. David Pruitt, who's one of our family practitioners at our Health Center for Women and Families in Farmville. And Dr. Carla King, who's a family practitioner.
Pediatrician.
Sorry. And she is at the Vernon J. Harris East End Community Health Center in Richmond. David Neff, who is at Hopewell Prince George Community Health Center, family practitioner. Dr. Tanya Paris-Wilkins, who is our dental director for Central Virginia Health Services and dentist. And Dr. Randall Bayshore, who's our clinical director for Central Virginia Health Services.
It's good to see you all. Thank you for being here.
And it's all yours.
Is it all mine?
Yes, it is. We have some people who have, I think, some comments to make. And
Well, I'd love to. I'm here to listen. I mean, I think many of you probably know that, my husband is a strong promoter of community-based health care because we all know that preventative care is critical to the health of our nation. And, all of you know what happens when you don't have these homes. People use the ER as a primary home, and that's not the best kind of care. And we can do so much more when people come into centers like this one and get the kind of care and education and ongoing treatments that wind up costing the whole society a lot less. So we're just grateful to you. I'm excited to be able to be here for this center. And I'm also excited about so many of you who are devoting your careers to community health. That is not an easy thing to do, but sometimes it winds up being some of the most rewarding work. And it's important to promote that to other medical students to understand that these opportunities are available and to make more of them available. So I am grateful to all of you and honored to be here to draw some more attention to the work that you'll be doing and providing a much needed resource to this county that has been underserved for so long. This is a huge step for this area. So with that, I will stop talking and listen, and then I'll talk some more later.
Dr. Sartre, would you like to begin?
Sure. Well, good afternoon. I was awarded the National Health Service Corps Scholarship during my junior year during dental school at Meharry Medical College. The Corps covered my tuition and fees for 2 years, and then in return I committed 2 years of service to an underserved area after graduation. The Corps provided to me not only financial support during dental school, but more importantly, the program aligned with my personal beliefs of serving the underserved. I have always been taught that one gives back their education, use their education to educate others. So in my case, I chose to use my dental training, which I felt would be best utilized by providing dental care to those that are in most need. I believe that all people have a right to health care, and that health care should be inclusive of not only medical coverage, but also dental and mental health coverage as well. My 2 years of service with the Corps, my focus is comprehensive dental care to everyone. Just getting a patient out of pain is not only a part of what I set out to accomplish during a dental visit. I strive to educate. I strive to educate each patient about the importance of good oral health. The effects of smoking, poor oral hygiene. These are common topics that usually arise. I am currently serving my second year of my commitment with the Corps in the greater Richmond area. I work at the Daily Planet for the healthcare for the homeless. Now, at the Daily Planet, our mission is to strengthen and enrich the lives of the homeless, uninsured, or those lacking the financial resources to create stable lifestyles. So ultimately, we treat everybody, regardless of their ability to pay. Of our 24,000 encounters last year, over 7,000 patients were seen in our integrated services, and then 92% of those patients were uninsured. In our recent point in time count, 63% of our new patients report that they have recently lost their jobs. Currently, our dental clinic is only a 3-chair clinic, a small facility, but next month we will undergo renovations thanks to our capital improvement program. So hopefully that will improve our access to dental care.
Where are you from originally?
Georgia.
Uh-huh.
You hear my twang?
Yeah, well, just sort of wondering too, how you're placed in an area. Is it, do you make a choice as a medical
You do.
provider? Or?
Once you graduate, there's a list that's available to you with various sites that meet the criteria. So the provider shortage area in certain counties is available to you, and sometimes the medical number may be a little bit lower than the dental number and things like that. So out of that choice, you interview and see what kind of best fits you.
Right. Now, do you find, particularly for the other physicians, that people are making use of the health corps? That are you seeing the numbers going up? Just in terms of.
That's hard to say for me. I'm not certain. I think it's a wonderful program. I've certainly benefited from it. And I believe that to whom much is given, much is required. So I would like to think that it is. Because it covers a great portion of your tuition. It's very rewarding. It allows you to really get out there and serve a need. As far as dental, it's not quite as large as the medical providers. You don't see as many dentists taking becoming part of the program as you do medical. But I would hope that would change soon. This is certainly a need.
Thank you.
Carla?
Hi, good afternoon. My story is a little different. I'm actually a loan repayer, and so that means I was already in a site and decided to use that site to get my loans repaid. And so I've been working I work in an urban setting in Richmond, Virginia, and so I've been there for 5 years. I've been with the National Health Service Corps under loan repayment for 3 years, and so it's allowed me to do what I like to do and I love to do. I trained at Howard in DC, and so I trained in a situation where we worked with medically underserved in a minority urban setting, and I wanted to stick with that. And so the National Health Service Corps has allowed me to live what I wanted to do, to live the dream that when I decided to be a doctor, that's who I wanted to serve. And so I'm the first physician in my family, so I've been able to stay and do what I wanted to do, but I incurred a lot of debt, to say the least. And so it's allowed me to use that money to really pay down and pay off that huge loan. And so I've been able to, work in the underserved area. I've been able to relieve a lot of financial load in doing that. And also I'm able to show other medical students, because we do have medical students that come through, and show them that you can work in a community health center. You can work and serve the poor and the underserved, enjoy it, and still have a good financial, status. You can still do the things you would like to do, as opposed to moving into the to the community where you have a lot more physicians and they're working in private practice. So I've been able to do that, but there's also a lot of issues and problems working with the patients, and so my biggest challenge is just providing health education to my patients. And so as a pediatrician, you know, most of the what you do is education.
Right.
You provide education to first-time moms, teenagers, everybody wants to know what to do with their health. But when you're working in an underserved community, there's a lot of myths, a lot of miseducation about their health, about their bodies. And so most of my time is done in just providing appropriate health education. And so one of the biggest challenges is just nutrition and obesity. I'm unlike other pediatricians where you have the rare cases of the 100-pound, 7-year-olds, but what you see more is just poor nutrition in what looks like a healthy child who doesn't get 5 fruits and vegetables a day, who doesn't have 3 dairy products a day. And so providing that education on a daily basis has been one of the biggest struggles. And so what the Capital Area Health Network, what we've done is we were able to get a Robert Wood Johnson Foundation grant. And so we found that it's not just us providing education. I get 15 minutes, maybe 20, maybe 30 minutes with that patient. And so in that time period, you're not able to give them everything they need. Because once they step out the door, the access to food, the access to an appropriate place to play isn't there. And so that's what our grant is trying to do, is provide access to healthy foods, access to a safe environment for children to play and to get out there and actually move around.
Yeah, that's wonderful. When we did our last healthcare event, we talked about this very issue. And there is a program, I know that my policy director, Jocelyn Fry, can talk more about it, but they're instituting, this is in Washington, sort of an initiative to help families figure out how to create those spaces where they are, as opposed to having people think, well, you have to live in a certain neighborhood.
Exactly.
How do they deal with the circumstances that they're in? How do they create play where they are, even if the playgrounds aren't available? And they've seen some tremendous gains because they're teaching families how to live healthy within their current circumstances. So, and I don't know if they got RWJ funding or not, but it would be interesting to begin to share some of those
that would be
best
great.
Practices. So.
Definitely.
So just to clarify, because I wanted to get a better sense, so when you came out of medical school, you didn't initially sign up?
Right, I wasn't a scholar grant, and so I didn't, because I was like, oh, I don't know where I want to be. Am I going to have a small list? Am I going to have a big list? So I actually came, and when I got out, I decided to work at Vernon J. Harris, and so I was like, oh, I love it. I want to stay. I have a huge debt, and so I was able to get the grant,
That's one thing I didn't realize, that you could apply after you're in.
It's nice. That's what I like about it, because you do have 2 options. Because if
it's
you
not
just
you have to figure it out right then and there.
In med school, exactly.
Right.
Yeah, the National Health Service Corps has increased that loan repayment program dramatically over the last few years, because it is people coming out and discovering, I do want to do this, that sort of thing.
Well, actually, in the Recovery Act, there's a lot of new monies.
Absolutely. So we're looking forward to that. Dave Neff?
Yeah, my story is slightly different again. I was blessed to be a National Health Service Corps Scholar recipient. Actually, right 4 days before I started medical school, I was awarded the scholarship, and was very much a blessing that financed my tuition and
Where are
helped
you
me
from originally?
I grew up in California and had lived in Arizona for a while. I actually worked for the Indian Health Service as a pharmacist, and that's where I became familiar with public health service and the National Health Service Corps, and decided to pursue medical school. I felt that being a family doctor was my calling, and I specifically felt called to serve the poor, the uninsured, the underserved. And so the scholarship I just felt like it was God's provision for me to be able to pursue that. I had resolved, even though I didn't know that I had received the scholarship, I had resolved that I would not incur any student loan debt during medical school. And because I felt strongly that I wanted to be a primary care physician, and I wanted to be in an underserved area, and I didn't want to be tempted to choose a more lucrative specialty or practice setting once I was finished because of the debt load. So the core scholarship was just a huge blessing and just allowed me to pursue that dream without incurring that debt load. And I think that's very important. I now teach through Medical College of Virginia, Virginia Cardinal Mills University. I teach third-year medical students one-on-one. I have between 9 and 12 students a year. And some of the things we talk about is the amount of debt that they have. And they ask me, can I pursue primary care, family practice? I have all this debt. How can I pay it off? I'm worried about paying it off. And I think that's one of the great impacts of the National Health Service Corps. Because regardless of how healthcare reform will play out, we are going to need more primary care physicians.
Absolutely.
And medical students in this day and age incur a lot of debt, and I don't want that to scare them away.
Yeah, absolutely.
So I served my obligation in a rural community health center and finished that obligation over 5 years ago, and was very happy with my situation, and I have been in community health ever since.
And how long have you been in practice? If it's not rude to ask.
I finished medical school in '97, so I finished residency in 2000. I've been at my current site about 5 years, and have loved it. It's been
That's
very
great.
rewarding.
That's great. Again, knowing that there are different avenues, because I think you're absolutely right. The average young person that is thinking about med school thinks, well, the only way to do it is to incur debt. It's sort of like I won't say a vicious cycle, because having trained medical professions is a good thing. But incurring that debt, it's the same thing with law for me. Once you sort of lock into the cost of that education, it almost destines you for a high-paying job if you want to sort of ever have a life. And just sort of helping young people figure out how they can do what they care about, get the education that they want, but not come out with debt and have the freedom to make the choices to engage in community service is something that we just need to do more of, because I think there are more young people who would pursue medical school if they could figure out the path to get there. So, well, thank you.
Are there, those are the prepared comments that we wanted to be sure you heard. Are there others of you who have anything to add to the conversation?
I would just like to say that I think well, let me start with my story just briefly. I am the dental director for Central Virginia Health Services, and it's been a wonderful opportunity for me. And I think if you would have told me what my responsibilities were before I accepted the position, I think I might have thought twice about it. But now that I'm there, and now that I have the ability to help so many people and change so many people's lives, I would not want to do anything else. I think a lot of our students coming out today are, for the majority of them in professional school, they come from privileged backgrounds, privileged settings. So I think if you are trying to attract them to this type of work in a community setting, you have to put an image on a face. You actually have to show them patience and show them how worthy the profession is that they're a part of, and how much people actually appreciate them. And I think once they see that, once again, they wouldn't think twice about coming out and working in a community health center.
Yeah. Well, I think as David pointed out, I mean, we are in a position where we're going to need more primary care practitioners, but the profession sort of puts a lot of stock in specialty care. I mean, you guys have all experienced that, even making the decision to stay in family practice or obstetrics or, all that. The incentives are to do just the opposite. When we're, becoming a nation where if we want to be into health care rather than health crisis, we're going to need more family practitioners. But young people have to sort of see this as a good alternative to the very sexy notion of what the specialty work does. And it is sort of changing the face back to, what do I remember? Marcus Welby, right? That was the doctor everybody wanted to be, right? There was, you laugh, it's like that was the doctor we all knew. And that's the doctor that, more and more communities are going to need. But how do you make young people who are being drawn into sort of the high-end practices with big money and big rewards sort of recognize that this work is essential to sustaining our nation's health. It's a big challenge.
We didn't set this up beforehand, but this is such an appropriate time for me to introduce Mrs. Rollins, Roberta Rollins, because her story is a story of coming to a health center with a pain and having it discovered by a primary care provider, and I'll let you continue with what happened.
Good afternoon, Ms. Brown.
It's good to see you. Thank you for being here.
I'm here on behalf of Dr. Bly and Central Virginia Community Health Center and UVA Hospital in Charlottesville. A year ago, I got ill, and I didn't have anywhere to go because I didn't have any insurance, anything. And I had this article stuck on my refrigerator, and my daughter said, "Mama, why don't you call them?" So I called Dr. Bly, and they told me to come up. That was January the 2nd. And he examined me, and he called one of his colleagues over at Mary Washington, and he told me, he said, "Ms. Rollins, I want you to go straight over to the hospital." So I went there, and they did an MRI, and found I had an aneurysm on my brain. And they couldn't operate it on there, so they sent me to Charlottesville. So they flew me
In the
down.
helicopter.
In the
Is that
helicopter.
urgent?
Oh,
Yes,
man.
ma'am.
Don't want that to be your first helicopter.
No. And I got down, and they operated on me the next day. And I was home the next day.
Wow.
And since then, with God's help, I'm here. And with Dr. Bly and Central Virginia Community Health Center and UVA Hospital in Charlottesville, I want to thank them for everything they've done for me. And through God's strength, I'm here. And if it wasn't for them, I wouldn't be here at all. So I just want to thank them. And thank you for having me today.
The pleasure is all mine.
Thank you.
We're glad you're here.
Thank you. Thank you.
But there's so many stories
There
like
are
that all
many,
over.
many, many stories.
You know, there's so many people who, and I would be interested in how you talk to your friends and neighbors now about healthcare, and you know, I mean, we got a few watchers here. You know, what do you have to say about the importance of community health centers and you know, sort of getting basic primary care?
I think they're invaluable because without them, the point is, people in my situation or someone worse a shape than I wouldn't have anywhere to go. And at the time, if I didn't have that clinic to go to, I don't think I would have made it, you know. So that's my story.
Well, it's a happy ending.
Yes,
It is.
yes,
It's a
ma'am.
good thing.
Anyone else that hasn't spoken?
Well,
Go ahead.
I just wanted to pipe up and give maybe a student perspective into things. So I'm really honored to represent the health professions students and represent the National Health Service Corps. I'm a scholar in the program. I actually graduate next May, which is a little scary. But I wanted to say thank you for having this forum, because really I think community health and primary care is really the heart of medicine, and this is why people go into medical school and dental school and nursing schools, because they really want to make a difference. And through things like this, we can really kind of show stories like Ms. Rollins, we were talking earlier, moving stories like that, and just kind of really ignite that flame inside of them to really pursue what their dream is. And you know what, if that means going into primary care, then that's what it is. And thankfully, we have programs like the Corps that can support that and incentivize primary care, so we have a strong workforce into the future.
So what are your plans? What do you?
So I'm
What's
actually,
next?
what's next? It's again, that's a little scary.
It's scary. Just
So
trying to.
I just got
You've got a
married.
whole year. It's just in May, right?
I just got
That's a
married in
long way
April, and
away.
my wife and I both
Oh, well,
are going to
that's the
graduate
scary
in May.
part.
She's going to do OB-GYN, and I'm going to do general pediatrics. So that's on the horizon, and actually she's interested in doing the loan repayment program through the National Health Service Corps. So I think both of us are going to very happily end up in primary care.
Now, in a situation like that, when there's a married couple, can you guys get placed in the same
Yes.
area? So
Thankfully,
there's
they have something called the couples match, so we'll be matched in programs that are within driving distance, so we don't have to be separated.
That's great.
Yeah, it's exciting.
So now, what about your fellow medical school students? How do you find in what school are you in?
So I go to the Baylor College of Medicine in Houston, Texas. Yeah.
So how are you finding that your classmates think about community health and the opportunity to get grants? I'm just trying to get a sense of how
Yeah.
med school students are thinking about this stuff.
So I guess just a little perspective. In 1998, about half of the graduating medical students went into primary care, and now it's down to about 35%. So there's definitely kind of been a drop-off, which is a little sad to see, considering how rewarding, community health is. And I really think if you just kind of connect them with primary care and give them experiences with preceptorships out in the community, it'll really kind of get them re-excited. Like I said, medical students really want to be out there to help people just like dental students and nursing students. So I think they would be more interested if maybe medical schools made even a bigger push to try and give them those actual experiences so they can meet people like Ms. Rollins and have that relationship that medicine really is all about. So I think there's some work to be done, and the passion is there. We just need to kind of find a way to reach out and grab that passion.
Well, thank you. And congratulations.
Thank
You'll
you
be
so much.
fine.
Thank you.
Look around you. They seem okay.
They made it.
Yeah, that's good.
Very good. Well,
Did David have?
Dave?
We'll be real quick. Just like Dr. King here, I joined the Health Service Corps after I finished my residency and made application there. And, we all went into the community health for the right reasons, we believe. And I chose a residency that was particularly a rural community residency where there's not a hospital 45 minutes in any direction. So that residency was an emergency room, was mental health, was primary care, was a babysitter, bringing people in the middle of the night, stitching them up, out on the tractor, they get cut, bring them in, stitch them up, we ship them off if we need to. And during that practice, I was lucky enough to meet these nice people at Central Virginia Health Services and was offered a job mainly to do women's health and obstetrics. So as a primary care doctor, being able to do obstetrics in the world of high malpractice insurance, it's the only way I could do it. And I wanted to go primary care instead of specialize in OBGYN, so it was a perfect match for me. And I would have gone to work for these guys even without the money, but it certainly is helpful. And so we do a lot of teen pregnancies, primary care, prenatal care for people that don't have anybody else to go to. So 95% of our prenatal patients right now are no insurance or Medicaid. So I believe we're making a strong difference here.
Yeah. Now, you touched on malpractice insurance. How does that work in, I guess I'm saying to explain to the
With
masses.
the malpractice, we have the best system in the world. It's called FMLA, which not FMLA, FTCA, Federal Claims Act, which we're basically considered to be part of the Public Health Service for malpractice. And so anything that happens at any of the community health centers, the monies for it come out of a Senate funding, and it goes through a review by the Bureau of Primary Health Care to make sure it fits, and then the Attorney General and the system for the legal system for the United States then handles the cases. So it's handled and decided on based on the merits of the case rather than all the sensationalistic types of things with it. So it's a very wonderful system, and it allows us to use those monies that we normally put aside for malpractice to put into the care of the patients then. So, and no one really ever has to worry about it. I was on the phone on the way here today with one of our nurse practitioners who got called because of the sudden death of a patient that, the husband's very upset and she's very, nervous and upset, and it's like nothing to worry about. I mean, it's a very good system, and it really is the way it should be. I know that that's not something that's part of the current healthcare types of things, but it really is the best system, for that.
Well,
If I could make one comment.
please do.
As a family nurse practitioner, you touched on it, but I also believe I've been a family nurse practitioner for 14 years. they serve as an invaluable part of community health care.
Absolutely.
So we do not have enough primary care physicians out there to service people as they get older, but I hope that as nurse practitioners, we can also fill in some of that need.
And if I could just chime in, I was originally, I'm Dr. Randall Bayshore, clinical director. I originally was a scholar, but got into it after my first year of med school. So I came to Central Virginia Community Health Center, which was just a wonderful experience. I then also did the loan repayment to pay off the rest of my loans, which is something that maybe Dr. Sartre might want to consider if that kind of thing is still available. Because even with having several years, there still is significant debt. And then since then, I've been the clinical director for Central Virginia Health Services. So I'm utilizing the National Health Service Corps all the time, trying to help recruit good physicians like Dr. Pruitt, like Dr. Paris Wilkins, other people. Like we have 4 sites right now that are listed with the National Health Service Corps, trying to get people to come. And the loan repayment system has been invaluable. The last couple of years have been much tougher because there hasn't been as much money. They did put in some monies back a few years ago, and unfortunately every year the debt goes up and the costs go up, and they have to put all the money aside right away. So there's less and less people that can go into it. So the Recovery Act, with the money, extra money going into there, we have 4 people applying right now that weren't able to get it before. One of Dr. Paris Wilkins' dentist that's applying, one of my nurse practitioners, and one of my family practitioners, are all desperately hoping to get it through this. And it's been very helpful because, they have a lot of debt, and it makes it a lot easier to get the kind of people that we want to with that system. So it's been invaluable for me in my recruiting efforts.
Thank you. Not to cut you off.
No.
I know we need to move along. We have one other task, an important task
Yes.
to open this place. And so what I'd like to ask this group here, if we're going to have a group photo, and with our guests over here, some of our staff, and as people from the federal system as well.